Trinity Health New England has announced some layoffs, including at St. Francis Hospital in Hartford. This all comes as coronavirus cases spike nationwide. Channel 3 Eyewitness News reporter Mike Savino is at the St. Francis campus in Hartford with more details on what's happening there. Mike.
Mark, this pandemic has certainly been rough financially on hospitals, even though many of them have been at or near capacity at some point during this pandemic. But of course, for the employees that I talked to, that doesn't make this any easier to accept.
It's a slap to the face, I feel like.
Johanley Thompson was a registered nurse at St. Francis Hospital for 3 years. But that ended this week after Thompson learned she'd been laid off. Several employees shared similar news on social media. Today, parent company Trinity Health New England confirming layoffs across a healthcare chain that includes 5 hospitals. They didn't say how many. Though there are positive signs that patients are returning for services, the organization expects the recovery will be gradual and there will be many unknowns with possible resurgence of the virus and the country's economic recovery, the company said. St. Francis declined our request for an interview.
We certainly haven't seen as profound an impact on the finances of the healthcare industry overall.
Connecticut Hospital Association Vice President Mark Schaefer estimates the pandemic has cost the state's 27 hospitals a combined $2 billion. This due to increased costs and expected lost revenues from non-COVID patients avoiding visits. Schaefer estimates federal stimulus funds so far have covered just half of that loss. St. Mary's in Waterbury, another Trinity hospital, has received $19.5 million in aid. St. Francis, $40.6 million. The 2 hospitals also got advanced Medicaid payments. $33.9 million for St. Mary's, $91.6 million for St. Francis. Hospitals do need to pay back those funds. Schaefer says more state and federal help is needed.
They tell us one thing and then another thing happens, and it just feels like there's no type of communication.
Thompson is aware of the budget crunch, but says Trinity Health didn't handle the layoffs properly. She also said things were confusing, being laid off just days after she learned her furlough had been extended. She says it's also tough to lose her job as people celebrate frontline workers.
I'm taken back by it because here I am ready, to help all these patients out, and I was there until I got furloughed.
Now, we reached out to Governor Ned Lamont's office for a comment on this story, but we got no response. A bit of bright news for Thompson. During the furlough, she started a cosmetic-related business, and she says things are actually off to a really good start. Reporting live from Hartford, Mike Savino, Channel 3 Eyewitness News.
All right, that is some good news for her. We wish her the best, Mike. Thank you very much.